Right, welcome everybody. I think we'll kick off now. So thank you so much for joining us for this webinar today on how is sensitive data made accessible for research. So I'm Lizzie Wade. I'm the Senior Communications and Engagement Manager for the DARE UK programme. So before we get kicked off, I'm just going to give you a quick reminder of what DARE UK is. And runs through some housekeeping rules for today. So DARE UK stands for Data and Analytics Research Environments UK. We're funded by UK Research and Innovation, which is the UK's biggest public funder of research and innovation. And our aim is to design and deliver a national data research infrastructure that's joined up, demonstrates trustworthiness and supports research at scale for public good. So what does that mean in practice? So when we talk about data research infrastructure, we're referring to the systems and processes in place to support research and analysis using sensitive data. So it includes the physical systems, such as the data centres where the data itself is held, the computer software that researchers use to analyse data, the governance processes, such as those guiding who's able to access what data for what purpose, and also the people who run the systems and do the research. So it's everything really that makes data research happen. So DARE UK wants to enable the different components of the UK's data research infrastructure to work in a more joined up way. So this means encouraging more best practice standards across the ecosystem, ensuring that the technology used across different organisations can work together more effectively. So, for example, researchers can access data held by different organisations for research projects in the public good. And we also want to make sure that the entire system demonstrates trustworthiness, and transparency and public engagement and involvement are really key to this. So the ultimate goal is to support more research using sensitive data at scale for public good for the benefit of society. Just to recap on what trusted research environments are. So we had a webinar on trusted research environments a few months ago, so we won't focus specifically on those today. So today's more about focusing on the governance processes in place that enable researchers to access data held within trusted research environments. But just to give a quick reminder of what they are. So a trusted research environment is a highly secure digital environment that provides access to sensitive data for analysis by approved researchers. So a series of strict security measures, some of which you'll hear more about today, protect the privacy of the people that the data is about, significantly reducing the potential for data misuse or the re-identification of de-identified data. And key to trusted research environments is that the data never leaves the environment when it's accessed by researchers. So they access the data either directly within the trusted research environment systems itself or via a secure connection to those systems. So just a quick run through of the agenda for today. So first off, we'll hear from Lily O'Flynn from the UK Statistics Authority and Bill South from the Office for National Statistics, and they'll have a run through the Digital Economy Act accreditation processes for researchers and also the Secure Research Service. We'll then hear from Chris Orton from Swansea University. We'll talk about the SAIL Databank in Wales and the Zoe COVID symptom study. Finally, we'll hear from Nick Webster from Welsh Government about the Administrative Data Agricultural Research Collection project. We'll then have plenty of time for Q&A and discussion, followed by some closing remarks. So just a couple of notes on housekeeping. So please do remain muted with the camera off at all times unless you're invited to ask a question during the Q&A. During the Q&A, if you do want to ask a question, you can either submit that in the chat or you can also raise your hand using the raise hand function at the bottom of the screen. And during the discussion, please do remain respectful, don't interrupt others, and make sure that any questions or comments do remain on topic. And just a note that the meeting is being recorded as well, So that will be published online afterwards for anybody to recap as well. So without further ado, I will just hand right over to Lily.
My name is Lily O'Flynn, and I am the Research Accreditation and Data Ethics Lead here at the UK Statistics Authority. And as Lizzie mentioned, what I'm particularly going to be looking at today is how secure data is made available for public good research that's enabled via the research powers in the Digital Economy Act. We can go to the next slide. Thank you. So firstly, why is the Digital Economy Act Research Powers, or the DEA for short, important? Well, the DEA is essentially a generic legal gateway that enables secure data held by public authorities, so government departments, universities, for example, to be disclosed for research that is deemed to be in the public good. The legal gateway applies to all public authorities, therefore can be used by multiple public authorities or government departments simultaneously to make linked data available via one legal and governance route, which is really, I suppose, the unique selling point for these powers, that when you're looking to access linked data, it looks to simplify that process by potentially removing the need to go to multiple governance bodies and panels that are linked to other alternative department-specific legal gateways. It's important to note that the DEA is accompanied by a code of practice, which sets the standard for how data must be made available to ensure that it's safe and secure and legally compliant through these standards. And that will be where a lot of the requirements on TREs and researchers sort of come in, and I'll explain that shortly. And then finally, sort of what has that got to do with the UK Statistics Authority? So we're actually named within the legislation as the body responsible for implementing and operationalising this code of practice, this set of rules, in order for secure data sharing to go ahead under the DEA powers. If we could go to the next slide. Thank you. So just then very briefly, what is the UK Statistics Authority? And how does this differ from ONS? So the UKSA is an independent body that operates at arm's length from government. So effectively, that's one of the reasons why we are identified as an appropriate body to oversee the DEA sharing powers, given that we are independent. We are linked to ONS, and that the ONS is our executive office. But we're also responsible for, I suppose, safeguarding and regulating statistics that are and research that's in the public good. The organisation's strategy is actually to promote and improve joined up data across the UK, and the DEA supports this by being applicable to all public authorities and looking to standardise research governance requirements to improve access to data. As I mentioned, we are responsible for overseeing the processes used to accredit researchers, trusted research environments and research projects under the Digital Economy Act, and that's a legal responsibility we've been given in the face of the legislation. Go to the next slide. So what is accreditation, and how does that differ to other parts of the sort of data access journey? As I mentioned, the DEA is accompanied by a statutory research code of practice and accreditation criteria, and this effectively sets out the principles that research projects, researchers and TREs must adhere to in order for secure data to be legally disclosed via the DEA. Accreditation is essentially the confirmation that all of these requirements are in place for the public authority, for example, ONS, to be able to disclose that information to a researcher in a legal and secure way. The reason why I'm bringing this up is we're often asked by researchers, why do you ask so much information from us at the point of application? Why do we need to give you sort of specific information about the project, its methods, its public good? That's because we're legally required to ensure that the way that you're accessing the data and how it will be handled complies with these legal requirements. If you could go to the next slide. So this slide really sets out the three sides that there is to accreditation. Researchers themselves need to be accredited, research projects that researchers work on need to be accredited, and then the processing environment, or TRE, that is providing access to that data needs to be accredited. We often think of this through a driving analogy, so I'm going to go for it even though it might be slightly cringy. So researchers themselves, their accreditation effectively acts as a driver's license. You're accredited for a period of 5 years. That means you're a fit and proper person with the appropriate skills and experience to handle secure data, and you have that badging for a period of 5 years. The accredited TRE is effectively the environment that you use to drive. So it's the roads, it's the speed limits on the roads, it's the directions that you're given, it's the highway code. It's all of those things that are in place to ensure that you can use that license in an appropriate way within an appropriate environment. And then finally, your research projects that are then independently accredited act as your cars. So providing you've got a license, the roads are there, you can drive as many cars as you like, as long as they've got their MOT, they're roadworthy, and you're insured. And that's what we're looking to assess as part of, I suppose, the research project accreditation. As you can see here, sort of these three areas of accreditation effectively enable us to ensure we're compliant with the 5 safes framework when enabling access to data. And I know that Bill from the SRS team is going to talk about that in a little bit more detail in a moment, so I won't go into so much detail on that. If we could go to the next slide, please. Thank you. So zooming in on processor accreditation, this is effectively the act of badging a research environment as trusted to prepare and host data that is disclosed to a researcher via the DEA powers. Being the statutory accrediting body, we in the Stats Authority are responsible for developing the framework used to accredit these TREs under the DEA. And we make this transparent, we publish it on our website, and this is really important for us in building trust among data providers, but also the public, to show the standards are secure and safe that data is being held under and provided under when data is being accessed under the DEA. We're also responsible for doing the actual assessments of TREs to ensure that they're meeting those DEA standards. And once a TRE is accredited, they're accredited again for a period of 5 years, but we regularly audit that TRE throughout that period to ensure, as a minimum, ongoing compliance to those security and capability standards that we set. Our accreditation framework is very much built to support the TRE in building capacity, improving its maturity, and enhancing its service provision for researchers. So we're always looking for improvements, and we're always suggesting recommendations on where these improvements might be. Just to give you an example of some of our listed TREs, which are all publicly available online, we've got the ONS SRS SAIL Databank, the NISRA Research Support Unit in Northern Ireland, the Scottish Safe Haven, and the UK Data Service, just to name a few. If we go to the next slide. Thank you. So this slide relates to our work, particularly on project accreditation. And to be honest, this is the majority of the work that we do within the team on a daily basis relates to project accreditation. There are some misconceptions, I think, across the research community in sort of various areas around how project accreditation works and why we're involved in it. But most will probably know this process or refer to this process as the Research Accreditation Panel Approval Stage, or the RAP process. Just a caveat, over the last 18 months, this is an area that we identified that we wanted to improve, as we realised this is directly within our control, and we can make efficiencies here, and so we have done. So to take you through what we do in this space, researchers complete research project applications and secure data owner approvals, ethical approvals, etc., with their chosen accredited TRE. Once all of that work is finalised, that's when we, I suppose, are directly responsible for the accreditation of the project. The project is passed from the TRE to ourselves for that accreditation. And just to stress that accreditation is to ensure that the way in which that data is being accessed and provisioned is legally compliant with our accreditation requirements. We work with TREs to agree whether the project can be accredited by us in-house, which, if so, and this happens in the majority of cases, takes approximately 3 working days on average to be accredited, or whether independent scrutiny is required. And I want to stress, this is in the minority of cases. We don't apply independent scrutiny to every single project. So where required, projects that have a risk of non-compliance with the code of practice are reviewed by our independent research accreditation panel for an independent accreditation decision, and on average this takes an additional 5 working days to seek that approval. This has come about because the RAP effectively identified that a lot of the code of practice sort of requirements are black and white. You're either compliant with them or not. So we have developed and applied to each project an accreditation tool that enables us to ascertain whether that project can be accredited without that independent scrutiny or not, while still upholding and maintaining those robust accreditation standards. Once the project's been accredited either by us or the RAP, the accreditation decision is passed back to the TRE to provide access to that data within that approved accredited project remit. So I suppose the point here is that we have done work to improve the efficiency of this process, but we recognise that there is potentially more that can be done either side that we can support with to sort of support with the completion of the application process in particular. So if you go to the next slide, just to sort of overview the support that we've provided around this thus far. So we're not directly responsible for the completion of the applications, but we realise that a lot of these requirements come from us legally. Therefore, we publish a lot of best practice examples and example applications and guidance on really to set expectations with the researcher on what does good look like, what should be included in a project application in order for it to meet those legal requirements, and how should that be articulated. We also have an ethics self-assessment tool, which provides a means for researchers to receive ethical scrutiny where they might not have access to institutional ethics committees. We run various training sessions with our accredited TREs on the application of our tools to ensure they're supported in doing that. We're in the process of developing video guidance to be published online that, as I mentioned, walks researchers through our accreditation process and sets that expectation up front as well. If we could go to the next slide, that's the final one from me. Just a series of links that effectively point to all of this information that's available on our website. Of course, happy to take any questions at the end, but for now, I'll hand over to Bill South in the Secure Research Service to provide specific detail on data access.
Hi, can you hear me?
Yes.
You can, okay, that's fine. Okay, good. I can't see myself, but that's fine. I don't need to. Okay, so hi, I'm Bill South. I head up the division in ONS that runs the Secure Research Service, the SRS. I think I've only got about 5 minutes, so I'll rattle through this fairly quickly. Okay, so you know what we're about is providing a service that gives accredited researchers access to de-identified, unpublished data to work on projects in the public good. We operate under a 5 safes framework, which I'll talk about in a couple of slides time. I just included a few numbers here just to give people a sense of the size of our operation. We've got about 5,000 accredited users, accredited researchers. About 1,000 of those are working on live projects at the moment. And then in terms of the sectors they come from, it's about roughly 50% academia and then 25% each for government users and private sector. So yeah, private sector are allowed to use the SRS so long as the project is in the research good. So it's not to for projects that'll sort of make them money, if you like, but it's more for public good type projects. We have about 600 live projects at the moment in the SRS, and there are approximately 125 data sets that are available that people can apply to use in their projects. The range there, about, I don't know, 80 of those are ONS data sets. The SRS started primarily serving ONS data, and we've expanded it in recent years to bring in more data from other sources, mainly other government departments. So the ONS data in there is obviously the surveys on business, labour market, those kind of economic stats. But we've also increasingly got, as I say, data from other departments, DFE, MOJ, BAYS, various others. We also got census in there, which is a pretty popular one, and also the COVID infection survey. So next slide. I mentioned, I just put this slide in very quickly. We've recently launched a new metadata catalog where users can sort of browse the data sets that are available. So you say those 125 odd data sets are all there, and you can search and see what's contained within those data sets to help you develop a good project application. So the next slide. Okay, so Lily, one of her slides touched on this already, the 5 SAFEs framework. So it's people, projects, settings, data, and outputs. If we go to the next slide, I'll just walk through what we call the researcher journey. The first 2 stages of this have largely been covered by Lily. So, as we say, in order to use the SRS, you first have to be an accredited researcher, and then you have to have an accredited project. And once that project's approved, then you can access the system. In terms of my team's involvement, we run the researcher training for the person accreditation. That will look at how to use the service, what to do in the environment, but also discusses in quite a lot of detail disclosure control, which is the output. Safe outputs is a later safe, which we'll come to. But it's important that researchers understand that before they start working in the environment. As Lily's described, the project approval process, and that takes you through there to the point where the project's approved, and then we move into the purple, which is the safe data. All data in the SRS is de-identified. Okay, so we hold no names and addresses, no email addresses, no telephone numbers or ID numbers that could directly be used to identify a person. So that they are stripped out before a data owner provides us with data, and that's true if it's a standalone data set or something that's been linked in a separate environment, which obviously needs to have those direct identifiers to allow the linkage. Once that's completed, the names and addresses are stripped out, and it will come into the SRS. Okay, in terms of the yellow there, the safe setting, users can access the SRS via safe rooms or something called safe pods, which are sort of if you like mini safe rooms where access is monitored, which are which are located around the country. The other option, we have a remote access scheme where organizations can apply. There's lots of criteria in terms of the security, and essentially what it means is they have a space within their organization where accredited researchers can access the SRS via their organization. So they're the access options. It's the data owner who decides what's available. So if a data owner says, I only want it to be accessed from a safe room, that's absolutely fine. So the final stage then, once the researcher has conducted their analysis and are ready to release their outputs, we have to check that nothing that's released will identify a person. So although say there's no names and addresses, sorry about the dog, there's no names and addresses in the data. If we release small counts from the environment, it might be possible that you could identify someone. So we have strict thresholds in the data about what can be released, and that disclosure control output checking is the final stage of the process. Once we're sure that we're not going to release anything about an individual or a business, then that analyst can be released. So move to the next slide. I think that's all I was going to say.
I think that's the end. Excellent. Well, thank you so much, Lily and Bill.
And apologies about the dog. He always makes a contribution in these things.
I'm sure it's a contribution that everybody enjoys. So thank you to Lily and Bill. If you have any questions for either of them, please do drop them in the chat, and they'll be taken at the end. But I will now quickly pass over to Chris.
Thanks, Lizzie. I'll just check if I can share mine okay. There we go. Does that look all right?
Perfect, thanks.
Smashing, thank you. So I'll just Get my bar out of the way. There we go. Okay, good afternoon, everyone. So yeah, my name is Chris Orton. So I'm a program manager based within Swansea University's population data science team, who are part of the Swansea University Medical School. And over the last 2 years or so, I've been heading up the sort of operations of the work that Sale Databank has done within the National Core Studies Data and Connectivity Initiative, which has been led by Health Data Research UK. And I'm also the program lead for the data side of things at the Breathe Data in Digital Innovation Hub, again under the HDR UK and MRC banners. So today I'm just going to be going through the Sale Databank itself very briefly and how we manage access to data for research, and then use the Zoe COVID study as a case study as to how we made data rapidly available during the pandemic. So the Sale Databank itself, and we can safely say that we're a trusted research environment. As you've just seen, we are Digital Economy Act accredited as a processing environment. We also run a global security standard, ISO 27001, in terms of how we keep data safe, secure, and within an information management security system. And we're operated by Swansea University, and we partner our operations with NHS Wales and Welsh Government. So the database itself is a core holding of anonymised data used for health, social care and administrative research, and that's around 70 plus data sources at the current time. Originally, this was created to pilot technical governance and operating structures in order to make primary data available for secondary data use for research, and that was only in the Swansea and West Wales area. But as of today, we now host data for the entirety of Wales and also for some UK and international data sets as well, to provide that data for research purposes. Currently, we're supporting over 500 research projects, and that's led to over 500 publications since our conception. So the Sale Databank itself, as I mentioned, hosts data sets for research from multiple data providers. This is primarily the NHS in Wales, but also local and national government level for Wales and the UK, academic institutions across the UK and internationally, and also working with charities such as the Cystic Fibrosis Trust. So we have robust anonymisation and governance procedures, which I'll go into a little bit more detail across the presentation, to ensure fair use and data protection, as Bill just alluded to, in the same manner that ONS would. And the application process for data is scrutinised by an independent panel who Sale administer, and that's made up of lay people, clinicians and scientists to act as the final say over how data is used. We also have data sets where the data owner themselves also has to put a final stamp on use cases to ensure everybody's happy with research going ahead. If approved, the way people access data, researchers access data within Sale, is to access project-specific views which have been tailored to their research project of the approved data sets via what's known as a virtual desktop infrastructure, so a remote computer that people can log into from their own location, but it will be logging into servers that are based solely at Swansea University, and that's achieved via two-factor authentication, which means you must use a device for a passcode and a password at the same time to get into our infrastructure. So an example of how we actually get data into the platform and how this is made available. In terms of the NHS Wales data, data sharing agreements clearly are the first and foremost thing we have to concentrate on to ensure that these are established to set what the rules are for sharing, what the legal bases are for hosting this data, and obviously any obligations that Swansea must have in order to keep the data safe and secure in providing this for research. Now, our model is that we split any identifiable data away from our organisation, so this always stays within the NHS, and we only ever receive pseudonymised data to start with into Sale, and that includes redacting certain elements of the data to ensure that we don't have anything overly granular coming to us for processing purposes. Now, once that is within the Sale environment, we perform extra checks on the data to ensure that that redaction has happened and that there are no pieces of information that we shouldn't be holding, and that this is suitable to be made available to researchers. And one step that we do to make sure that the data is truly anonymised by definition is that we encrypt the identity of the patients in individual level data further. So this is a two-sided irreversible process. The NHS do one level of it, we do a second, and then there is a third level of that encryption again before it is given out to projects, so that there's no backwards path in terms of any way to get back to a person's identity. Now, in terms of the Zoe COVID study, as an example, this particular data set was generated from citizen science and during the pandemic was an incredibly prevalent source of publicly generated information obviously reporting on how infection by symptom was potentially spreading across the UK. And this was very useful in addition to the NHS and government data that obviously we also hold, particularly in Wales, but this was a UK-wide data set that we were hosting. So the data set itself in anonymised form allowed the tracking of COVID-19 at local and national level geographically. And this was before routine testing and track and trace, etc. was set up. So it enabled us and the research community to actually understand exactly what was happening as far as we could, as reported by people who were experiencing COVID-19 symptoms for the first time back in 2020. So SAIL acted as the Breathe Digital Innovation Hub TRE, and we partnered with Health Data Research UK and Zoe themselves to make the anonymised data from Zoe available to primarily the NHS, local authorities, national government agencies and academic researchers for ongoing COVID-19 research. And as I've mentioned previously with the NHS Wales example, we followed the same processing path to set up a data ingest from Zoe with some slight differences to make sure that this could happen as quickly as possible. So as before, agreeing a data sharing agreement, the big change was that we were receiving pre-anonymized data here. So there was no pathway of turning identifiable data within our systems into anonymized data. We were receiving purely anonymized data that Zoe ensured was anonymized as we were receiving that. So that included taking, obviously on the Zoe side, somebody's name, turning that into an anonymized code, and then sending that to us where it would be encrypted again to ensure that there was no reversibility in that process to get back to somebody's actual identity. In terms of the technical aspect, this data set was rather large. There were obviously millions of people contributing to this, and we had to create an automated daily transfer mechanism for millions of rows of data to come into us. And the reason it was done daily was to ensure that anybody who removed their consent or anybody that added themselves to the study by downloading the app and any new variables that came in could be changed on a daily basis to ensure that it was as up to date as possible when it was being given to those who were doing the research. We obviously also put that review in place, as I've mentioned earlier, which is both a technical and a governance process to review the data to make sure that it conformed to our anonymity policies. That there was a dedicated team set up at the start of this whole process who would ensure that the data was only going to those who were permitted to actually see the data and obviously actually use this for research purposes. So as mentioned before, this was primarily for emergency response purposes, NHS bodies, local and national government and other agencies. And obviously there were also academics helping to feed into that who were commissioned by those bodies to actually access this data, who had fleets of analysts ready to analyse it. The way that users had to access the data again, they had to sign data access agreements, send us CVs to prove that they had the analytical capability to use the data and ensure compliance with safe researchers such as the Digital Economy Act, as has already been mentioned. And access to the data in the SAIL Gateway, which is the remote environment for the research, was actually used by mobile authenticator in most cases because of the geographical disparity of the users. Normally this would be a YubiKey, a physical token, but we pivoted to mobile authenticator purely because posting things across the country would have been too slow a solution, and also because we were all working from home, it wasn't actually viable to do this at the first point in time. So in terms of the way this is given to users, data was provisioned on a sort of bi-weekly basis rather than daily itself, because we had to make sure we processed it to give that to actual users. And we had to set this up as an automated flow to ensure that it didn't compromise any ongoing work, so any changes to the data didn't stop the analysis happening. And secondly, ensure data was up to date to make sure that the actual counts, figures and any findings were actually relevant as and when they were distributed. In terms of the governance, as mentioned by Bill, for the ONS-SRS, it's very similar with SAIL. All outputs are subject to SAIL's DEA compliant output checking process. This is again for small numbers, ensuring that whoever was requesting it was allowed to request such information out, and that the information was being fed back in to the pandemic response. The legacy of all of this work essentially was that we were able to maintain concurrently 60 odd projects which ran across the public sector and academia using this data. Now the total is over 100 in terms of those that have actually used this data set for pandemic research. It's one of many data sets that SAIL pivoted to and onboarded for COVID-19 research in partnership with NHS Wales and with UK studies looking for Welsh components and UK-wide components of data sets. And we also made these discoverable and available at field level across the data connectivity and HDR UK Innovation Gateway sites. So any approved outputs from the research, including have included over time symptom modelling figures to help feed back into government strategy as to how the COVID pandemic was going to progress, mapping of the symptom prevalence, and lots of publications into COVID-19 associations to work out how best we could deal with this as it progressed. I think that's everything from me.
Excellent, thank you, Chris. So again, any questions for Chris, please do just put them in the chat, or you can raise your hand during the Q&A a bit later, and I'll pass over to our next speaker, Nick.
Brilliant, thank you all. Have you got my screen?
Yes, we can see the PowerPoint version, and now
Fantastic.
the slideshow. Still in the PowerPoint version, actually can't see the slideshow just yet.
Oh, just aware of time, so
yeah, it's fine. Carry on.
If that's all right with everyone else, means I can also see my notes, so that's great. And thank you very much for inviting me to speak today.
Actually, Nick, I think we've lost your slides. Sorry.
Take two. Just try not to do anything clever again.
Yeah, that's great.
Fantastic. Brilliant. So I'm Nicholas Webster. I work with Welsh Government as part of HDR Wales, and this is an effort to bring together academic researchers with government analysts to try and unlock the skills and potential of both to work together on administrative data research through trusted research environments, building on the excellent work that colleagues have already talked about. But today I just wanted to have a quick chat through the ADOC project. So what is ADOC? The ADOC project is Administrative Data Agricultural Research Collection, and this aims to bring together data on human dimension of farm households, so individuals in farm households, with data on farm activities. We've been able to study both in isolation before, but this is the first time we've ever been able to look at both at the same time, and it provides some really exciting opportunities to use administrative data in very secure and legal and ethical ways to really help support the farming sector as it faces some significant challenges over the next few years. So we bring together experienced data linkage researchers and experts in agricultural affairs with partner organisations across the UK. And research will investigate relationships between farm household characteristics, recent farm and land use activities with a view to improving the design of future policies. Okay, so the data, one really exciting thing I think about ADOC is we're attempted to do this across the UK. So we're building 4 different research-ready data sets in each of the UK nations, which are fairly comparable, have very similar data, but do differ based on data availability. I think the point of this slide is just to show how complicated the situation is around the UK. We're building something similar, but it's different in all 4 countries. And what we're going to do with this data, so we've got 4 research work streams. So household socio-economic characteristics. So what do modern farm households look like? A lot of it's very anecdotal, based on traditional imagery of what we think farming is, but the actual evidence of this is actually quite sparse. Health and well-being. So what are the common accidents that face farmers? What's the mental health like of farming households? Prosperity and business resilience. So if every farmer's married to a Fortune 500 CEO, farm subsidies probably aren't that important. But if that's the lifeblood of the business, we need to think really carefully about how we reformulate these policies after leaving the European Union. And finally, environment and place. So how are farmers adapting to the challenges of climate change? What types of farmers are engaging with government on some of these schemes and what aren't? And what can government do to better increase farmers' engagement with some of the activities government's trying to put in place? So Lizzie's asked me to talk about the researcher journey, and I wanted to start by saying this is a really complicated project. Not all projects are as sort of convoluted as this in some ways, but as we're working in 4 different countries, we're working with 4 different trusted research environments that are 4 different trusted third parties and 4 different application processes. And I think this has been a really good opportunity to understand how the system works across the UK. I want to start by saying I'm really grateful for the work of SAIL and the Stats Authority and the ONS. we've come an awful long way, and the fact that we can do this at all is really exciting in such a secure way. But this is just to sort of spread the researcher side of things, that it still does take an awful long time to get this in place, and it's quite a complicated process to access the data. And I've got my own flowchart. I think it does match Bill's to a great extent, but just from a researcher perspective, there's researcher activities, research governance, data owner governance, TRA activities, and then a really important part of this as well is wider engagement with members, people who are in the data, stakeholders, data owners, so that there's a lot of work that goes into accessing data in trusted research environments. So I just want to go through, break it down. So start with researcher activities. So researcher accreditation, as Lily mentioned before, most TRAs now accept the central UKSA DEA accreditation, and this takes a couple of weeks to come through. This has been a huge step forward. Previously, each of the TRAs had their own application processes, and it would have been a nightmare to try and do this across all 4 TRAs. Researcher access in TRAs, metadata is massively improving thanks to the data catalogs that I think Bill mentioned before, but it's still patchy on some data sets as it's not been collected for researcher purposes. It's sometimes quite difficult to know what is and isn't in data. Some TREs like SAIL are now accessible remotely, which is great, but some TREs are now only accessible in person via safe rooms. And then finally, results out is now a straightforward process due to a lot of the work that's been done elsewhere. And oh, you can't see, there we go. Time taken for ad hoc on this is weeks. Research governance. So I think Lily mentioned project governance under the DEA, but a lot of the TRAs also have additional governance processes. So generally they all have a sort of project proposal phase, which is really useful exercise in checking the feasibility of a project, but varies quite significantly throughout the UK. Ethics assessment, again, helped massively by UKSA standardization efforts, but there are a number of different ethics obligations on various different academic institutions, and it is still a bit of a checkered picture. Evaluation of public benefit of research. So again, each government across the UK does have their own way of evaluating public good, and the definition of this varies quite significantly. Timescales as well are better than what they were, but there is still quite a significant backlog in some of the TRAs due to COVID. And again, I think it was touched on before, but if there is anything challenged, you can get put to the back of the queue. And some projects do end up taking quite a long time clarifying what public good means to be able to pass this stage. It's a very important stage, but it does feel like an area that could do with a bit more thought and a bit more consolidation around the UK. Time taken for ad hoc for this area of accessing the data has been months. And then coming on to the big one that I think is, to be honest, quite a hard one to crack, data owner governance. So all of this work is reliant on the approval of data owners themselves to give their data to trusted research environments, and it's getting a lot better, but generally all data owners require data protection impact assessments, which are really important, and make sure that we are doing everything in accordance with legislation, the Digital Economy Act and GDPR. But there's different formats between all data owners, between different government departments. There's a lot of risk aversion, understandably, but part of the Digital Economy Act is to try and give a legal basis to allow this work, and that's still yet to peter through all of government. And again, different interpretations of the same legislation. So is health data covered by the DEA? Is financial included by the DEA? There's still a lot of realization of what the DEA actually means among data owners, which will really speed things up. And then separately as well, I think Chris also talked about data sharing agreements, but in the experience of ad hoc, often slowed down by legal technicalities, complications of who's responsible for what, and often just need high-level sign-off from very busy people who have a lot of other concerns on their minds. And time taken for this one, I think a little bit controversially and pushingly. I'm still not quite sure what I should say here. We've still not managed this for some of our data sets. And I think this is the one area I would say needs a lot of attention from there, really, if there's any support that could be done there. But it is an improving picture, and very grateful to the work of a lot of very passionate people across the UK making this happen. Then finally, TRE activities, so we've touched on them again, but just to say that also takes a little bit of time. The identification of data is very resource dependent. The identification between the TREs is all quite solid, but is done in different ways, which means that if you sent some data to one TRE, it would be anonymised in a different way to a different TRE, which isn't the biggest issue, but it can cause problems when you're trying to aggregate results from across 4 different countries, and it can be a bit of a black box just figuring out what the methodologies are in each of the TREs. And then finally, disclosure controls, very important. They're reasonably quick, but there's inconsistent rules here. Some rules are about rounding to like the nearest 5. Some are like they won't let anything under 10 out, so won't let anything less than 20 out. And you can sometimes run into problems by forgetting which rules you're working under, and it's a manual process. So time taken on the whole over the course of the project is probably more like months than weeks, although it's getting better all the time due to the excellent work of the TREs themselves. And then I just want to finish on a wider engagement point. When friends find out what I do, they think that I spend all my days looking at how much they get paid and snooping on their data. Not true at all. I spend all my days in meetings, actually, talking to stakeholders, talking to other academics, talking to data owners, talking to government analysts, and talking to policy makers. And I would say this is such a huge, important part of the project, and it's all the way through. It adds so much value that I don't think this is a bad thing. I think I just want to raise the fact that it's not something that researchers do in isolation, and it's something that needs to be worked across government, academia, and the general public, just to make sure that what we're doing is useful, it's having an impact, but it's also protecting data subjects and is transparent. So I'll just finish on some final thoughts and challenges about why we're here today, but how I think DARE could help is building a common understanding of legislation and policies and helping communicate that and help data owners feel a bit more comfortable about what they can and can't do. Increase transparency of administrative data research, so making sure that we are shouting that we are doing this, but it's safe, it's secure, and inviting not just stakeholders in, but the general public in to engage with this work. And that just makes it all so much more transparent and safer, but it means that we're also getting feedback from people on the ground. Increase consistency across TREs. There's a lot of good protections in place, but just the variety just adds so much extra work for researchers. Develop technical solutions to work between TREs. Like, some of the ideas about federated querying between TREs would be really exciting. And then just ongoing support metadata development. It's a lot better than it was, but it's just still an area that could do with a lot of extra work. So thank you very much. That's my thoughts.
Thank you, Nick. And thank you so much to all of our speakers. So we now have time for some questions, and I can see there's already quite a few in the chat and some discussion that's going on. One question that Chris has picked up, but I think could be worth just putting out to the other speakers as well, is around de-identification and anonymisation, and if there's a difference between the two. So I'm not sure if anybody would like to pick that up, perhaps Bill.
And here he is. Yeah, so I think the question was, is it the same? And no, it isn't. De-identified, so we're stripping out names and addresses, direct identifiers. That's not to say it's still record level data. So it's still possible that a researcher might, especially if the characteristics are unusual, recognize somebody in that data. But that's why when we talk about the five safes framework, is that all those things work together to reduce the risk of frankly that if that risk is there, that anything materializes from it. So I guess the key one probably is the safe people. So the training, is directly telling researchers really how to run their analysis in a way that doesn't risk the confidentiality of subjects. They're reminded that they shouldn't go looking for individuals, and there's a legal requirement on not to do that. They also want to complete the training. The assessment backs up that understanding of how they should act in the environment, and they sign a disclaimer saying they won't do that. It's also worth saying that we can record sessions. So analysis really is about researchers running code on all of the data rather than going poking around looking for individuals. So it's very much that understanding that the individuals don't do that. The other safes kick in as well. I mean, the project, it's very much a sort of data minimization. They're only given access to the data they need to answer their research question. So it's not a free-for-all, and that's part of the accreditation of the projects process. Others have touched on the final stage, the safe outputs. Again, as I said in my slides, you don't release low counts. I mean, that's the point of it. So all of those things work together. So what we call it is sort of functional anonymization at the point of use in a secure environment.
Great, thank you, Bill. I can see James Rossen, you've got your hand up. Is that to come in on that de-identification anonymization point?
Yeah, absolutely. So you said it as I was thinking it, the functional anonymization process as well, but it's also that I know government departments that have data matched to be held within the SRS consider the data to be pseudonymized. And that hasn't yet moved on to be fully recognized as being functionally anonymous. And I was wondering whether that's going to happen and what the timescale of that might be.
So I'm not quite sure of the specifics. I'd say that what our position is that, because of the combination of those, the point of use within the environment, then it is functionally anonymized. But I think you're talking perhaps about a step beyond that. Perhaps I don't.
No, it's just experience with a government department that still considers it a pseudonymous data and unwillingness to. Well, it's not unwillingness, it's just uncertainty around the use of functional anonymization completely. So it was just functional anonymization is essentially anonymization in terms of the law, which would free things up to make things much easier to get access to and use from a legal perspective, because that wording is quite important. And I guess that's where I'm coming from, really.
Yeah. Okay. No, that makes sense.
Thank you. Okay, so I'll just move on to another question. So I think there's another one for Bill here. So are there plans to bring health data into the ONS service to create consistency?
Bill, did you want me to take this question?
Oh, yeah, sorry, I'm fiddling around my, yeah, Lily, you go, I can chip in if needs to be, but yeah.
Thanks, Bill. So there is, this probably relates more to the Digital Economy Act and the research provisions within that, more than being TRE specific. So the Digital Economy Act enables, as I mentioned, public authorities to make their data available for public good research purposes. There is a limit within the DEA in that public authorities that hold data that's used for the provision of adult health and social care services cannot be disclosed under the DEA. So I want to make really clear that it's not all health data which is outside of the remit of the DEA, but it's particularly that health data that's used by a public authority to provide health and social care services. So to put that in real terms, health data such as the COVID infection survey, some records within census that's collected relating to health, ONS births and deaths registrations, that's all able to be made available under the DEA because that is health data that isn't used to provide a health service. It's effectively statistical or admin, well, not admin, statistical health data that ONS collects for statistical purposes. It would only be that health data that's collected by NHS, for example. That would be outside of the scope of the DEA. But what we do in order to enable health and DEA data projects to go ahead is we work in collaboration and partnership with alternative governance panels and legal gateways to enable projects to access data through multiple routes. And we've got a large emphasis on doing this in as streamlined a way as possible, as we recognise that when multiple governance panels or multiple legal requirements need to be met for a single project, that can complicate the process. So we look to work with those other legal gateways in order to minimise the burden that places on the researcher.
Great, thank you, Lily. We've just got time for a couple more questions, I think, and then any others we don't get to, we can answer afterwards, and make sure to share those. So a question, I think, for anybody who wants to answer: the potential for good with the use of data sets in the SRS and SAIL is incredible, although the numbers of researchers and data sets seem quite low. What are the next steps to increase the good work that can be done? Does anybody want to come in there? Bill, go ahead. Looks like
well, I can do if no one else. So I was just reading the other comments. I think it's fair to say, it's worth saying that we've increased quite dramatically over the last 2 or 3 years. It's also worth mentioning there are plans for an integrated data service, which is a cross-government. It will be a TRE as well. It's a cross-government program which has ambitions to scale up the release of more data for this kind of purpose. So yes, it has been growing, and there are plans to make it grow further. I can pick up very quickly a couple of those questions if you like. There was one about, can we make it more easy to get machine readable lists for the accredited researchers? I think there are plans underway to do exactly that, so that we can run an API so that you can get the list of researchers. So I think that's underway. There was another one about is it a data lake? The SRS is more like a data lake. The IDS will be more of the data warehouse holding structured data.
Excellent, thank you, Bill. Just looking at the chat, I think all of those have now been answered either in the chat or out loud. Feel free to just put a note in if that's not the case, but I think that's the case. So thank you very much for all of your questions, and I'd just like to hand over to my colleague Jerry just to give a couple of closing remarks.
So thank you, Lizzie. So yeah, I'll try and keep this quick because it's been a great discussion. So first, on behalf of the DARE UK team, wanted to thank Lily, Bill, Chris and Nick for the presentations, and everybody for their participation. The questions and discussion in the chat particularly has been absolutely excellent. We're currently looking at what the recommendations will be from the DARE UK team, building on the great work that's going on already in the TREs and from the UK Statistics Authority and the work around SRS and everything else. So we're building out some recommendations, looking to build on best practice, to look at how we improve access request management, how we improve accreditation of environments and of researchers, but not reinventing the wheel, really building for that capability and looking at how that can apply for sensitive data across research domains. So that work is underway. That was part of really the reason for running today's webinar. So we'll soon be sharing a draft of that work. I hope everybody is signed up for newsletters that Lizzie puts together. We'll soon be publishing a draft, and we really value your thoughts, comments and recommendations, whether you're coming at this from a member of the public, or whether you're a researcher, or whether you're running a TRE. You've all got brilliant perspectives here. It's research on personal, on sensitive data, and so we'd really like to hear your thoughts and views. So more information will be out in a forthcoming newsletter, but those recommendations, draft recommendations, are coming very soon. So finally, I'd like to thank you for taking your time out during your lunchtime today, and I hope you have a great rest of the day. So thank you, everybody.
Thanks, Jerry, and thanks, everyone.